All right, my friends, it looks like yet another doctor has quit. What is going on? I feel like this is happening almost every single week. Today, we've got Dr. Kristina Braly, an anesthesiologist and YouTuber, and I'm gonna be reacting to her video about quitting. And for those of you who are new here, my name is Kevin Jabal. I actually quit plastic surgery a few years back, and you can see more about that over here. Now, let's dive in.
Where's the balloons? I need some balloons, some confetti, some fireworks. I have quit my job as an anesthesiologist.
Right off the bat, I love how excited and upbeat she is. She's clearly happy with this decision, and it probably feels like a new chapter for her, so happy for her.
As you know, medicine is a changing landscape. The pandemic has shifted everything. Places get shut down because of COVID. I am a private practice anesthesiologist, and it became very apparent to the company that I worked for needed to shift things in order to move manpower around, especially in a region or territory, without having people on the clock not doing anything.
All right, so two things here. Number one, she's pointing to the fact that because of the pandemic, a lot of outpatient procedures and surgeries were being canceled. And you see a lot of people who weren't on the front lines with the ICU or emergency department or inpatient medicine. A lot of them were actually having less work to do, especially at the beginning of the pandemic when we had a lot of uncertainty and people didn't want to increase the risk of transmission by going to a medical clinic or hospital. So that's the first thing. But the second thing that we can't forget is that medicine has been moving in a certain direction that the pandemic has perhaps accelerated, which is you have a lot more corporate interest, you have a lot more private equity money, you have a lot more forces influencing medicine that I think many of us feel are taking it away from the priorities of patient care and sustainability, keeping the various people in the healthcare team happy and working for longer periods of time. And I think that's culminating here.
The shift to anesthesia being sort of a mobile job, although I think it's very smart from a business perspective, it's something that no longer worked for me. A bunch of us were asked to be able to move all around the town, sometimes multiple places a day, or sometimes not knowing where you're going until like 8 o'clock the night before.
So that flexibility is very helpful from a business perspective. The company is able to lower costs, lower wastage, and more effectively allocate resources, human resources. But the issue is that for the anesthesiologists, the other professionals who are being impacted by this, it's kind of a pain, right? It's kind of a pain to not know where you're going until the night before or even the morning of. So it makes sense.
And I basically shifted my status from full-time to something called PRN. I can now work when I want to. I might be asked to work at one site one day or the next day or in the future. Keep working as an anesthesiologist. I'm not quitting the field of anesthesia.
So that's key right here is agency. She has control over her time, and that is so key. That's what a lot of us actually want. And I'm sure we're gonna explore that further because I have a lot of thoughts on that. I love that aspect of entrepreneurship.
But I do have more flexibility, more free time to pursue my creative passions. I have been happier. I am escaping something that was really dragging me down.
So what's interesting here is that she mentions loving anesthesia, but then also feeling dragged down, and then also her other creative pursuits outside of medicine that she really loves and bring her joy. Now, I think the key thing here is, number one, creative pursuits, in my opinion, they are much less likely to get dull, boring, and monotonous. When you have that creative expression, and some of us are more or less creative than others. I'm no artist and musician and whatnot, but I still have my own creative energies, and when I'm able to get that out, I feel like there's more novelty and excitement and less routine and going through the motions. So I think that is part of sparking that joy that we see in Kristina. And the other thing is that the dose makes the poison. So if she's able to scale back and have more control and only work as much as she wants to, she's gonna enjoy it a lot more.
I am free to do freelance work, which in the medical field is called locum tenens. I will be available through various agencies to be available as needed. So whenever there is a shortage of an anesthesiologist, whenever a facility has someone sick, patients still need surgery, so I can kind of show up and be an anesthesiologist and love my job and love what I do. but have the freedom to say no and take a job only when I want to.
So locum tenens is very popular usually at the beginning or the end of one's career. And it seems like Kristina is pretty experienced and it's happening at the end of her career. The reason people do it at the end of their career is increased flexibility. They have more control over their time, their schedule. They don't have to take call. They don't have to work holidays or weekends if they don't want to. And it looks like she has the optionality. I know that she has a scrub company. I know that she has a husband who also works. So when you have those other sources of income, you're then able to say no and only work when you want to work. Now, the reason that people at the beginning of the career do this too is that you tend to make a higher hourly rate. It tends to be a little bit more exciting. You can travel. There's different types of locum tenens, right? So I don't think that Kristina is trying to go to like Australia and do locum tenens there for 2 months. But when you're younger, you want to be more, explorative, and you want to have unique experiences and get, try different populations, patient populations, and work with different people and have different practice types. Then that's a really popular thing to do as well.
That has really been like my dream for the past year. I want to create a life where this will be possible. I am a freelance anesthesiologist now, which means I might show up, at one place, a random place, anytime.
One other key thing to keep in mind is that doing locum tenens is going to be a function of your specialty. You're not going to really find locum tenens plastic surgeons as an example or neurosurgeons as an example because you need that continuity with your patient. Whereas you are more likely to find it with things like anesthesiology, emergency medicine, things like that.
It's an exciting chapter for the Braly family. I have felt so good over the past few weeks. I am just so much happier. I am so much happier. I can't even tell you how much happier I am to be kind of free of something that was...
Yo, freedom is key. Freedom is so key. We don't realize that's what we want. A lot of the things that we are pursuing in life are ultimately a reflection of our desire for freedom.
It's very hard to let go of something, especially a secure, stable, full-time job as a doctor. I am just shifting how I approach the days that I work and when I work. I want more flexibility to take my kids places. I want to travel.
The other thing too that I want to mention about younger people doing locum tenens is that they usually are working harder and longer hours. So again, the type of work you do in locum tenens at the beginning of your career versus the end is very different. So if you are younger, you're not really able to forego a lot of work and take fewer shifts, make lower income because you're early on in your career. You got to pay off your student loans, you got to establish yourself, things like that.
That was very limiting. The fact that I was trying to launch a business, which I worked on for a year, but it really kind of hit me like lightning when I decided to do it. The goal has been to really kind of push everything that I do in this space and even offline. There are a lot of things that I work on offline that I don't talk to you guys about, and I think that is really kind of taking a front seat for now.
I feel like there's two types of people in the world. Those who have a million interests that they want to pursue and it seems like there aren't enough hours in a day and life's not long enough to do all of them. And then people who are more comfortable with a steadier pace and working a single job, and that's totally fine. That's not a huge pain point for them. So I feel like I can relate to Kristina in this aspect that there's a million things I want to do. I mean, I just started a new car YouTube channel as an example, so I can relate.
You could see even, I told you guys, I shifted my hours. I came back from maternity leave last year, going down from 40 hours a week to 30 hours a week. I thought, that's great. Like, that's all I need. That's gonna be perfect. And then I'll go back up to 40 if I need to. And I still found myself struggling with burnout. I think the pandemic has really affected a lot of people, but particularly healthcare workers.
So one thing that's interesting here is that she's working 30 hours a week and was still feeling burned out. That's a lot lower than average for a physician. But I think the main reason is because she's working on other projects outside. So she's counting 30 hours as an anesthesiologist, plus I'm not sure how many hours building businesses. And building businesses is not easy.
And I think that it's really important that we protect ourselves mentally, emotionally, physically, and know when it's time to just step away for a little bit. When I was doing anesthesia, when I was administering anesthesia hands-on myself, I am happy. I love it. It's like the biggest privilege and honor to be able to put someone to sleep, wake them back up again, and have their life in my hands. It's a very profound honor and privilege, and something that I've trained more than a dozen years to do. But what I found wasn't making me happy was all the things that I talked about previously.
Very common theme amongst physicians, right? You see them loving the patient care aspect, the actual practice of being a doctor, of taking care of patients, of doing surgery. And yet it's the other things that seem to be taking a larger and larger role or portion of their day that's causing issues. The bureaucracy, the scheduling, the drama, the this, the that.
I quit my job. I am so happy. I get to be with my kids. I get to hang out here. My lease was up at my other office, so I will be looking for another place possibly. But right now I'm just back in my home office, loving life. I am making content about what I want to make content about.
I remember when I quit my plastic surgery residency, I was just sitting there at my table in my mostly packed up apartment, and it just hit me like just completely differently in that moment that, holy crap, I got a blank slate in front of me. There's normally for most of our lives growing up, because I quit when I was in my like 27 or something? Yeah, 27. Most of our lives up until that point, if you're gonna become a physician, is you do high school, then you do college, and the MCAT, and then med school, and then USMLE, and there's always the next step, the next thing you're working towards. And when you're out on your own, it's like tabula rasa, it's blank slate. You can do anything you want to, and it's kind of exciting and kind of terrifying at the same time. Again, different from Kristina's situation, but you get the idea.
And it just goes to show that, like, you know, medicine and healthcare, they're not the only things that define your personality.
Yes! What do I say about identity? You can't identify too strongly with anything, including your profession as a physician or your diet as a vegan or whatever. If you hold onto an identity too strongly, bad things happen. And the cool thing is when you do leave medicine, you don't have to throw it away, right? You can still use your unique perspective of medicine as a physician to then start your new business or your new project. I know that she's doing scrubs, right? So something that's very healthcare related. I'm doing medical education, something that's also very healthcare related.
And while I do think it is a calling, it also doesn't mean that you have to set yourself on fire to keep other people warm. And you also need to still put yourself first. And
that's key right there. That's key.
It just became no longer something that I wanted to do anymore. So I'm really happy. Where's the balloons? I need some balloons, some confetti, some fireworks. I am happy. I'm so excited about this.
I love how happy she is. I love how happy she is. And to touch on what she said about not setting yourself on fire to keep others happy or to take care of others, that's a really key point. And because of the way that medicine has been moving over the last few decades, it's as if physicians are being squeezed dry for everything they can produce in terms of just production from a business perspective. So you gotta be careful of that because that's contributing to burnout, and you gotta put your own oxygen mask on first before you can put it on for others.
And so I feel like being able to support my family while also doing the thing that I love is just the dream. If anything, a takeaway message from this video is that you need to carve out your career, and it doesn't always look like everybody else's, and that's okay.
It's not just okay, it's more exciting that way. When you carve your own path and you're doing something truly unique, you're an N of one. If you're just following a cookie cutter approach to X career, X job, then I think by definition, because it is not unique or not as unique, it's not as exciting in most cases.
And be okay with taking only the things that bring you joy.
Okay, so one thing I disagree with her there, it's hard to just pick the things that only bring you joy, because no matter what you do, if you start a business, if you find another job, if you change career paths entirely, you're gonna be hard pressed to find something where you only do exactly what you love to do. For anything you do, you're gonna find elements that are not bringing you joy. That's just life. Even artists and celebrities have aspects of their jobs they don't like. Even athletes have things that they don't enjoy.
But sometimes it just takes a leap of faith and something to really kind of like be like, yep, okay, all right, God, this is you telling me this is that time.
I like what she said about taking a leap of faith. I feel like a lot of the most rewarding things in life are on the other side of fear, where you walk towards the fear and you confront it and you face it and you handle it, and afterwards you're just like euphoric.
This is a fluid situation. It's very possible that in a few years from now I'll be back at work full time. I'm not intending this to be something that I do for the rest of my life. But this is just what I want and need right now. And the beauty of this is that I can shift this however I want.
When you make life-changing decisions like this, things that are really big, it's great to have optionality. So what she's pointing out here is key, that she's going to locum tenens. She's not completely leaving medicine. She has optionality, and she can, at that point, from locum tenens, then go towards decreasing her hours further, focusing more on her projects, or going back to anesthesia and putting less time into her projects. So optionality is key. Sometimes, just based on the circumstances, you won't have that optionality. Like for me, I can never go back to plastic surgery, but if you are able to have the optionality, then definitely take advantage of it.
It's so nice to be able to have the choice, and I think the freedom and flexibility. So like choice, freedom, and flexibility were really like the biggest things, and I'm very excited to try that out. So we'll see how it goes. Thanks so much for watching.
Congrats to Kristina. Guys, if you have anyone else that you want me to react to, let me know with a comment down below. Thanks for watching, much love, and I'll see you all in that next one.